The lungs of individuals with Down syndrome don't develop as fully as those without, which has an effect on endurance performance and should be considered when you're designing a conditioning program. That is not to say that you should lower your expectations, but rather understand how to prescribe the appropriate intensity and duration once you get to know your client. So we already covered a few anatomical cardiovascular abnormalities that are common for individuals with Down syndrome, and in the event that they are present and serious enough to cause concern, they are usually corrected with surgery. But let's talk about the subsequent cardiorespiratory fitness that would influence how clients with Down syndrome may perform. Individuals have a higher net metabolic rate when walking. A decreased stride length is one factor. We see reduced VO2 max due to a combination of low peak oxygen uptake and poor exercise economy, meaning their movement is not as efficient. This could be a result of joint laxity and hypotonia. When exercising at the same intensity as their peers, individuals with Down syndrome were found to be operating at a higher percentage of their VO2 max and expending more energy. Chronotropic incompetence appears to be a cause of low VO2 max as well, as max heart rate that is 25 to 30 beats per minute lower than their peers without disability. This is defined as the inability of the heart to increase its rate matching increased activity or demand. It's common in patients with cardiovascular disease and makes exercise uncomfortable. This is another one of those negative feedback loops that we talked about earlier. Individuals with Down syndrome might be predisposed to secondary health outcomes like cardiovascular disease. One of the ways we address this risk is through consistent exercise. However, due to some physiological conditions, this can be a challenge, but we've seen anecdotally at our facility that individuals with Down syndrome can thrive in a supportive fitness environment. Overall, there are several congenital heart defects that are more common for individuals with Down syndrome, but these will be scanned in infancy and addressed surgically if needed. We know that aerobic exercise is important for this population, but that similar efforts are more challenging for athletes with Down syndrome due to some physiological characteristics. Therefore, intensity and duration should be modified accordingly. We want to try to incorporate higher intensity training when possible, but understand that the athlete may not tolerate intensity as well as their peers, that enjoyment is an essential component of adherence to an exercise program. The length of the interval and the implement used should be appropriate so that technique isn't compromised. And lastly, the client may require more rest to recover between intervals. Let's look at the impact that cognition has on performance and participation.